Thank you very much, Dr. Professor Ahmad Fauzi, for, I would generally simply say, it's very much a comprehensive presentation within the short and limited time that were provided. Dr. Ahmad Fauzi covered something which we can say covered geographical elements, that the threat of xenophobia, I'm not just talking about COVID-19, as I'm talking about xenophobia now, is covers all various areas in the world, but it's not only the different areas in the world, but it also covers the various time span in history. And one interesting point to note based on the presentation by Dr. Ahmad Fauzi was also his mention about some of the poetries by the, if I'm not mistaken, the British poet Rudyard Kipling, as that made me recall some of my lessons in school, in Sekolah Kebangsaan in Malaysia, that we also refer to some of his poetry in the English lessons. I remember one of his poetry was the poem "If," even though maybe that one was not specifically on and related to xenophobic elements there, but certainly others do hold some elements of xenophobia as presented by Dr. Ahmad Fauzi. Okay, without taking too much time, I would next like to introduce first our next speaker before inviting Dr. Azhar. Certainly, Dr. Azhar Ibrahim is not an unfamiliar face to viewers and to participants of events by Islamic Renaissance Front IRF. Dr. Azhar is a lecturer at the Department of Malay Studies, National University of Singapore and US. He obtained his PhD MA at the same department before joining NUS. He was also a lecturer at the Nanyang Technological University. His research covers a lot, quite similarly with Dr. Fauzi earlier, on literature of Muslims and the sociology of knowledge. Without too much more elaboration, as I believe most of you all are familiar with Dr. Azhar as well, I would like to invite straight away Dr. Azhar to deliver his talks.
All right. Thank you, Ihsan. Thank you, Professor Ahmad Fauzi. Professor had actually given us a good coverage for introduction and very interesting snapshot of what happened in terms of the expressions of xenophobia, racism, stigma, and so on. So in my slide, let me share my slide here first. All right. I must qualify here that I'm not an expert in the health discourse. Okay? Although I would say that I've been very much interested in critical discourse pertaining to, in particular, racism, yeah, stigma, prejudice, and of course, xenophobia within it. So when Dr. Farouk invited me to this session, I thought that, I dig up some files and just rearrange some materials that I've read before. So this will be my presentation, and I hope the second part, which we need to deal on solution. Just now, Professor Ahmad Fauzi mentioned that maybe I have the solution. I don't have the solution, of course. I'm just deliberating on those points that have been made by various writers and scholars, right? So allow me to begin with this quotation by Elie Wiesel, Nobel Prize winner in 1986, who says about human suffering anywhere concerns men and women everywhere. I swore never to be silent whenever and wherever human beings endure suffering and humiliation. The key word here is human suffering, and that would be something that I think very much related to the issues of xenophobia. Xenophobia is actually, of course, perpetuated by racists or moral exclusionists, and the result is, of course, human suffering. Yeah, and of course, I think also in one way that those who perpetuated it also might be suffering of something. Yeah, and of course, we know this philosopher Susan Sontag. All right, which says about, well, Ignis, it's like a passport everyone holds, and something like, at the end of the day, all of us will be subjected to illness too. So don't be like always saying that you are better off or anything else doesn't matter to you, because it might happen to you, including stigma, racism, xenophobia, right? You easily want to perpetuate on others, but in some other processes you will be subjected to it too. I mean, if we can extend this kind of rationale. Well, this is just to show an example of various expression when there were these diseases, or pandemics that spread, or including endemics, and also it comes with xenophobia. One was in the past, historically, we know about leprosy, 1918, the Spanish influenza, that happened too. There's a lot of people who are subjected to discrimination or xenophobia. Of course, in our modern era, HIV, right? I mean, quite interestingly too, not many people want to talk about how people who are subjected to HIV were subjected to xenophobia. Those who have HIV, right? I mean, this is something which I think we just brush aside because we think that this is other people's problem, right? 1994, the Indian plague problem in the state of Gujarat, it was quite well documented what happened in that Indian state, to a point that borders were closed, and those migrant workers were rejected by neighboring states, right? Of course, in SARS happened at that time. I remember I was still in campus. I still remember that this fear of China student, right? Because the association with SARS with China, right? Then of course we have Zika, and then today we have COVID-19. If you want to list, there's a lot of diseases or pandemic viruses, yeah? And in fact, one would say that based on my reading, the influenza stigma during 2009 H1N1 pandemic was worse than the stigma on HIV. I mean, there was a conclusion made, right? A study has shown that it may be possible to reduce people's feelings of prejudice towards others with influenza while maintaining the desire for distance from others with influenza. I mean, there's two consideration here. On one hand, you want to maintain a certain kind of distance, but at the same time, you want to reduce those prejudice or those xenophobic sentiments, right? So the present predicaments of us today in this era of COVID-19 is basically two things. Yeah? One, we still yet to find the vaccine. Hope we can find it in the near future. And the other one is actually the challenge of infodemic, right? Fears, rumors, stigma. In fact, this is quoted from the UN website, right? WHO website, in fact, acknowledge this problem of fear, rumors, and stigma. And it says here that an excessive amount of information concerning a problem such that a solution is made more difficult, right? In fact, already we have this problem, and now it is aggravated by the human condition, which is actually xenophobia. All right. So generally, what we can observe that there's the blaming of these endemics or pandemics on foreign others. All right. This is recurring throughout history. Professor Ahmad Fauzi had done it well just now on this regards. And then, of course, with this infodemic, we see also fake coronavirus cures sold online, right? These are, some kind of the infodemic, and all this created the anxiety, unnecessary anxiety, cyber attack, and then even on hospital information system, and so on and so forth, right? And we know that initially this at a popular level, it was this COVID-19 was given the name of Wuhan or Chinese virus. Trump had said that, yeah, and of course, good that WHO deliberately intervened and said as COVID-19, right? And of course, in history, HIV, before it was given that name, it was coined as gay-related immune deficiency, GRID. Can you imagine that, right? And it was conceptualized as a plague that impacted at-risk population in the US. Yeah, and there are few risk category, right, which I will deliberate later. All right. What happened when COVID-19 spread? I just want to give you a rundown, just sampling what actually happened when COVID-19 erupted, and it creates snowballing of anxieties and confusion, right? And of course, it also opened up our eyes when we begin to see, one, the state of health facilities, including medical personnel. Then we question how much we have invested in our health system. All right. We begin to see that resources on private medical facilities vis-a-vis state-run, is imbalanced. Of course, in some other countries, maybe not in Malaysia or Singapore, but in some other countries, private hospitals have more facilities than state hospitals. Yeah, and then it's something strange that we celebrated all this medical health, but there's one industry that is quite booming, medical aesthetics rather than medical caregiving, right? So a lot of resources that once meant for medical health, medical caregiving, all right, being put for medical aesthetics, and of course certain class group enjoy better than the rest. So in terms of resources in a society for health purposes, you can see kind of imbalance, right? And all these tell us about also the preparedness of the government and healthcare system. Two, we can see that the immigration policy, right, and the implementation, of course, and the presence of migrant and refugees, whether documented or undocumented, right? This is something which is, for lack of better term, maybe lags or maybe some kind of collusion or certain private interests that allow undocumented migrants coming in, yeah, as cheap labor, right? Or worse, human trafficking. So when COVID-19 came, then we begin to see, everything crop up because every segment of the population and the resident needs to be accounted for, right? And then we begin to see homeless in urban cities. Yeah, of course, homeless has been all around, but COVID-19 really opened up our eyes that what kind of living conditions that they were subjected to, and the kind of the urban poor living in poor health and sanitation areas. Yeah, and then also it opened up our eyes to see that citizens with no social security, health insurance. We begin to see also that the network of social services for the poor and existence of, whether there is an existence of food bank, right, which supposedly to be one of the criteria, yeah, in maintaining or what I call it, social security, food security in a country. And of course, the living condition of migrant workers, right, within our means. They are part of our workforce, but somehow they are outside our social security system, or worse, they are outside of our moral system. That's even worse, right? Seventh, the fragility of employment sector. It can tell us about how much we dependent on foreign worker. Not that I'm saying here foreign worker is not good. I'm saying that to a point that some sectors are rather imbalanced, right? High level of food import, right? And then of course, most importantly, the rise of xenophobia, right? Manifesting in ethnocentric claims, stigma against foreigner, all right? And this is not only disturbing in its articulation, but interestingly, we must observe the relative silence to correct it. And I think glad that the initiative made by RF and friends here, right, to talk about this. I'm not an expert to go in to go deeply into this point, but at least raising some issue I think is of importance. All right. So how it manifests the xenophobia? One, stigma. Two, racism. Three, in the forms of moral exclusion, which is a more kind of like kind of attitude or values that we see on others. And of course, the fourth one could be on the tendency of isolationism, right, which is taken up by some countries. Is that a manifestation of xenophobia? To me, it is. right? So what is xenophobia? I won't go into the long debate on this point. I'm just giving you points here. This form of attitudinal, affective, behavioral prejudice towards immigrant and those perceived as foreign is fear of foreigners, and their impact is linked with ethnocentrism. It is, of course, discriminatory, prejudicial, especially boosted by ideology. And what kind of ideology? Ethnocentrism. All right. It is also, of course, associated with times of economic and political instability. We always need to find the black sheep to blame on others, right? Perceived threat on foreigners leading to prejudice, all right? It can be a realistic threat, symbolic threat, intergroup anxiety, and negative stereotypes. You know, if you go through the literature, I mean, a vast area on the discourse of prejudice and moral exclusion, you can see all these terminologies coming up. And I think good that it must be taken up more and more in social sciences, right? Of course, the xenophobia is fostered by misinformation, right? And the what they call it, the denial, yeah, sorry for that, the denial of the positive development potential of migration, right? Migration has many potential, the positive potential of migration, but we don't actually talk about it. But migration has been part and parcel of any human society and human civilization, you know. But in the hands of the ethnocentric, suddenly it becomes very dirty and very ugly, right? And of course, just I mentioned isolationism, right? So this is what happened. Xenophobia breeds racism, right? Or xenophobia is racism is part and parcel of xenophobia, depending on how you define it, right? But most importantly, all right, the manifestation, like what Professor Ahmad Fauzi had shared, I think that's very good enough. Just want to quote where at one time in US there are 4H, right, which is to be avoided or to be scrutinized. One, homophiliacs, heroin, homosexual, and Haitians. Right? So common xenophobic sentiments towards immigrants. Right? Immigrants take away our jobs. Immigrants increase crime. Immigrants are burden to our social services. Immigrants become a threat to society. They might be possibly terrorists, maybe, or immigrants become arrogant and demand their rights. Who are they? You know, they are just penumpang. You know, I mean, this word, you know, we coin, you know, of recent in our discourse. Right? Or I have even heard, you know, immigrants take our women, yeah? And that's strange, right? And of course, stigma. Stigma generally leads to barriers to seeking help, right? If you go through the discourse of, say, on the nature of prejudice, propounded by Gordon Alport and later on picked up by few others, Pettigrew and friends, the discussion on stigma and prejudice is very important, right? So stigma present major barriers against healthcare seeking, reducing early detection and treatment, and furthering the spread of disease. Two, social marginalization often can lead to poverty and neglect, thereby increasing the susceptibility of the population into that disease. Third, stigmatized population distrust health authorities and resist cooperation. Finally, stigma distort public perception of risk, resulting in mass panic among citizens and the disproportionate allocation of healthcare resources by politicians and health professionals. Right? Professor Ahmad Fauzi mentioned in detail just now on racism. I move in focus on stigma. Right? So linking pandemic with xenophobia or stigma is crucial to show that the disease is not virus per se, but also the human and social dimension that aggravates it. In fact, it's much more harder to cure, right? If we have the vaccine, COVID-19 will go, but xenophobia will stay. And in fact, it will be infecting other places, other dimensions, right? Health is issue, racism is health issue, xenophobia is health issue, according to Richard Norton. You can read many of his short articles, right? And he has been calling the medical professional to take up, yeah, to come to the forefront to say something about this, not just settling on the issues of the practicality of medical help, but on the social dimension. He says this: members of the medical community prefer to avoid becoming entangled in divisive issues that seems to be outside the scope of medical concern, but their voices are needed to confront xenophobia, rejection of science, populist hostility towards expertise. And this also tells us to what extent social scientists, philosophers, literati, right, intelligentsia, right, voicing out, right. Worse, when we have a kind of social sciences that no longer interested to talk about human crisis, human predicaments, and only loaded themselves with issues of theoretical gymnastic and theoretical fanfare, right? So this is where I want to introduce, you know, and in a bigger health discourse, people like Paul Farmer, all right, and then also Ian Wilkinson and Arthur Kleinman, all right. These are the people who always, I think, persistently wrote pieces, right, deliberating on the issues of health, not just on its medical ground, but also on its social dimension, right? One of which will, in this Pathologies of Power, I think the title itself can tell you, the subtitle, Health, Human Rights, and the New War on the Poor, right? Tracing the ways in which suffering patients with AIDS and of their families is created by socio-economic inequalities, compounded by inappropriate use of resources, magnified by discrimination, augmented by fear, and amplified by the loss of social identity, right? So we need to recognize social suffering. In fact, it's good that social suffering again enter into our discourse, into our moral and intellectual imagination. All right, this is not something meant for just philosophy students, right, or people doing social psychology, right? So in discussing xenophobia, we need to link this notion of human and social suffering. And a book by Ian Wilkinson and Arthur Kleinman, I will suggest a very good read on this issue, although not specifically on COVID-19, but it will tell you the kind of health system in which very much that we have neglected the notion of compassion, right? So this is where I just quote a bit here. The theory of social suffering collapses historical distinction between what is health problem and what is a social problem by framing conditions that are both and that require both health and social policies, such as in urban slum and shanty towns where poverty, broken families, and high risk of violence are also the settings where depression, suicide, post-traumatic stress disorder, drug misuse cluster, and so on and so forth. Right? Although these are clearly occasions when health policy and social policy have different targets, it is the poorest communities, the medical, economic, and the political may often be inseparable. So xenophobia is not just about one ethnic group, all right, being the victim. Xenophobia could also mean a certain class group, right? And xenophobia here linking to social suffering, and social suffering, all right, must be looked at the various group that were subjected to it. Okay, so the research and writing on social suffering to draw social science in an overtly humanistic and humanitarian direction meant to solve the problem of xenophobia, stigma, racism, and the like. Yeah, I raise this because I think along the way, I mean, let's be frank about this, right? I mean, how much, especially those who live, who stayed in campus for long, studying in campus. I mean, what kind of modules normally you come across, right, that speak about public health issues, right? Management of public health, maybe they are, but how public health includes xenophobia, kind of racism, should be incorporated. I mean, I come across medical anthropology and so on, but this kind of discourse that Ian Wilkinson and Arthur Kleinman are not very much in the mainstream, right? This is still in the peripheral margin discourse, right? I think since this COVID-19 is important to bring back again, right? Because social suffering, right? We take this provocation of social suffering as a spur towards the alignment of social inquiry with pedagogy of caregiving. This is what we need, right? We seek to cultivate sociologists and anthropologists motivated by global humanitarian social concern, and more important, for this result in real and effective practices of care for all people. There is passion for society. Okay, so how do we mitigate or we solve this problem, right? I think there's about 12 points here. I'll go very fast. One, nurturing and promoting critical discursive ideas and idioms into the public sphere. First of all, yeah, public needs to be equipped with a critical dimension that something is wrong and therefore it warrants our moral inquiry and our moral position to say that that is wrong. Yeah, for example, monstrosity of prejudice, structural violence, racism, right, must be part and parcel of our social inquiry and our social discourse. Reading by Cornel West, for example, on moral reasoning versus racial reasoning, actually is one of the good way, right? Then we need to scrutinize the kind of idiom used, the parlance, the expression, the language of xenophobia. This is a language of hyperbole. One of the most obvious example of this is the tendency to inflate the volume of migration beyond the boundaries of reason and logic, and so on and so forth, right? I think in our case, if we do a field work, right, this language of xenophobia can be easily documented. It can become very good academic exercise actually, right? But of course, academic exercise not just for the sake of publication, but of course to address the current problems and therefore to solve it, right? The proactive position of institution of higher learning, right, to promote research, of course, not just about its scientific, right, but of course linking it to xenophobia, discrimination. Here calls for sociology of humanitarianism. Should be given a space to develop, right, where we can appropriate a discursive having the language of critique, reconstruction, and caregiving. Third, involvement medical sciences and healthcare with critical social. That's what just now, Horton has mentioned earlier. Fourth, involvement of medical science and health with critical social science perspective, right? So yeah, the first one is actually the third one is actually what we call it. I think the third and the fourth one should not be a repetition. The third one I meant those in the social science need to know about what is actually happening in the public health. The other one is that medical sciences and healthcare needs to appropriate critical social sciences into their discourse, right? So two different things, right? But of course, similar approach. I mean, similar intention. Overall, the need of what we call today biosocial approach, bring together the biological and social sciences to develop an integrative, collaborative response to the threat of pandemic, right? Here, various biologists, epidemiologists, ecologists, historians, social scientists, they have been writing about pandemics, but all working in silo. What we need is to combine them together. Yeah, this is where multidisciplinary, cross-disciplinary is needed. I think we have not invest much on this, right? 4, 5, 6 rather, familiarization with the social history of epidemics. We read history of our medical institutions, right? But social history of the epidemics not very popular, right? So I think those in the history and political science sector, right, needs to take up on this, right? 6, they need to mitigate stigma by conscious planning and managing the pandemic via what? Via building such capacity trust. This capacity trust must be built up in the community, right? Support the social status of first-line healthcare providers. Government transparency, official silence will only reinforce misinformation, public mistrust, right? We have seen, some countries are not transparent in this. At the end of the day, more confusion. Right? Optimism in human effort. right? Which is what they call in some of the writings non-pharmacological intervention, NPI, right? Which should include the mitigation of stigma. In other words, the healthcare planning must take into consideration of xenophobia and stigma, how to deal with it, not just about right, rearrangement of medical facilities and its social distancing measures. Right. 7, the need to rethink and reconceptualize our notion that citizenship equals to social benefits for health. I think many countries, many society think that, well, we can give you that healthcare, that swab test if you are a citizen. If you are not, all right, then you have to pay or you will not be included, right? This thing needs to be changed, right? I mean, this is not, I'm not the only one who says this, but of course you can find it in many of the writings in the healthcare discourse, right? In discursive front, we need to correct the tendency to conflate globalization and migration, with the claim that the migration will bring about the loss of jobs to locals, right? If you're serious to mitigate xenophobia, to mitigate stigma, right? You need to build up a critical discourse that dismiss all these misconceptions, right? It can be done where? It can be done, of course, at large research center, NGO, think tank, the press, right? We need more of our undergraduates to read this kind of work, right? Not just talking about globalization, right? But to see that there is a discrepancy in linking easily globalization and migration problem, right? Of course, in the hands of the ultra right, right? This is actually their fodder. Okay? And just now, the role of medical public health and health fraternities, of course, is very important, similar to the points earlier. But with the emphasis that health is about power and politics, it's an important moment to recommit ourselves professionally and politically across the entire spectrum of medicine and public health to defeat the insidious social pathologies of hate, racism, xenophobia, and terror. Public health or medical science cannot keep quiet on this, right? It must be mandated as part of their discourse, right? They must find their voice and join public discussion earlier, similar to the quotation I had, right? In other words, public health cannot be simply seen as a neutral scientific domain, but it is a political activity informed by science. Public health has a moral mandate that complements its scientific mandate too, right? Okay, so the need to refer back, yeah, the 10th point is to refer back some of many declaration, conventions, agreements. Yeah, one example is the Bellagio Statement of Principle signed in Italy in 2006. Yeah, which recognized the fact that socially and economically disadvantaged groups and individuals are almost always, the worst affected by epidemics. Right? I think this is where people of various training come together, right? Scientists, sociologists, activists, right? And they come forward and they have this 6 point, right? I'm just going to read very quickly. All people should have ready access to accurate, right, up-to-date, easily understood information about avian and human pandemic influenza, right? 2, veterinary and public health strategies should foster wide engagement in planning for and responding to the avian and pandemic influenza threat. 3, planning and response should facilitate public involvement in surveillance and reporting of possible cases without fear of discrimination, reprisal, or uncompensated loss of livelihood. Fourth, the impact and the effective for intervention and policies need to be evaluated and monitored. 5th, developing as well as developed countries should have access to the best available scientific and socio-economic data analysis to inform avian and pandemic influenza. And finally, national and international efforts are needed to promote equitable access to vaccine, antivirals, and so on and so forth, right? So these are the statements, but where are the statements? And I'm sure in each country, there are always a kind of like commission of inquiries, always look at practices of discrimination, the practices on human migrant laborers and recommendation made to the government, reports after reports, right? Where are those reports? Whether the reports are really executed? We know there are many reports to make the conditions better. But again, right, with this COVID-19, we see actually many works have not been done, right? And that is very sad, right? The need for international coordination. This is important, right? Clearly, we need a coordinated response to xenophobia, not just respond to how our airports open and our borders open in terms of its coordination, but to xenophobia, right? And for international organization to work in tandem with national governments, yeah, and all other agencies, right, like migrant association communities in addressing the problem of xenophobia. The crucial element of such response would include a coordinated comparative applied research program to measure xenophobia and evaluate effectiveness of intervention. Yeah, this require serious scientific endeavor, right? And of course, it needs to trickle down in terms of public education or in terms of socialization. Sometimes we have all these good materials in documents, but when it comes to public education, we don't receive it, right? Sure, the last point, the narrative of hope and optimism, right? Exposing several facets of COVID-19 stigma to effectively reduce it. This is the irony to it, right? Because it can raise the consciousness of the public. This includes exposing, eliminating racism, xenophobia, and recognizing the social processes of othering already experienced by person blamed for COVID-19, all right, and so on and so forth, right? And intersecting stigma, right, such as racism and poverty. I mean, this is, right, I mean, the discourse not just health issues, right? It is compounded with many other things, among others, racism and poverty. So creating space for stories of COVID-19 that reveal stigma and solidarity of frontline health workers and people living in quarantine, sorry. These can reduce fear and spark empathy by helping us to see ourselves and our communities reflected in the pandemic. Understanding our shared humanity and precarity of distinguishing the sick and the healthy may be the step towards fostering solidarity. We need not only focus on the stories of hardship in the midst of this pandemic, but to showcase those good human efforts of solidarity and camaraderie. And I'm glad also during this period, there's a lot of posting on how we help each other as a community, right? But more needs to be done in the discursive fronts and also at the same time in raising the problem of xenophobia at the social education and even at the research level, right? So before I conclude, allow me to read this poem. Professor Fauzi quoted, of course, from the religious tradition. Let me just quote from this powerful poem, I think, by Gabriel Algeria, and this is what on the issues of structural violence and extreme suffering. That calls for our attention, calls for our moral position to take and to speak and to take action for them and with them, right? At night, I listen to their phantoms shouting in my ear, shaking me out lethargy, issuing me commands. I think of their tattered lives, of their feverish hands reaching out to seize ours. It's not that they are begging. They are demanding. They earned the right to order us to break up our sleep, to come awake, to shake off once and for all this lassitude. Right? This lassitude is our nonchalant, our ambivalence of not taking action of these human predicaments before us. All right? We need to get rid of COVID-19 in as much as we need to get rid of xenophobia. On that note, thank you.